Thank you for joining us today on the program Healthy Living. I'm Adesu Wagia. Today we're going to look at sexually transmitted diseases, particularly chlamydia, which some persons don't really know about and don't know how they come about it or what chlamydia is all about. Joining me today is a medical lab scientist. Charles Nwachukwu is the MD of Chonak Diagnostic Center here in Benin City. It's nice to have you join us today, Mr. Charles.
Morning, madam.
Okay, so what we did on radio is what we're going to do today. So now let's talk about STD. So tell me what STD is all about.
Now, STDs are sexually transmitted diseases. That's diseases you get when you have more than one partner or when you have a partner who already has a disease, right? There are different kind of STDs.
Okay.
You have from the ones you listen to while going to Ring Road, and then you hear
the one that we hear almost every day.
You have Candida, you have Clamidia, you have Proteus, you have E. coli, which is Escherichia E. coli. There are quite a number of them. But I think for today, we are going to talk about chlamydia.
Yes. So talk to us, what is chlamydia? And how do you get it? Two questions in one.
Okay, so chlamydia is more of a sexually transmitted disease.
Okay.
Now,
and that's the only way you can get it?
Yes. Okay. Not exactly, because a pregnant mother can give it to a child. And then that's why you see that some children at birth have pneumonia or even eye infections. Now, chlamydia can cause about this for young children. You notice that for women who are looking for an issue, most times you have the doctors, the IVF doctors, who come around and then tell you that you must do chlamydia amongst the parameters, because why? Chlamydia can lead to a very high level of infertility, especially in women. Wow. You know, like we said on radio the last time, the country we live in right now, a lot of people want to always accuse the women that, oh, okay, the women are at fault, and then the women are always promiscuous or something. But then at the end of the day, we tend not to actually like focus on the main issues. Okay. Some of my masculine gender now won't like this
your gender.
But then the thing is, personally, I feel if we actually take away the focus from the women sometimes, and then we look inwardly in our own selves, it would give us a better clarity about things like this. Okay. Now, for example, prior to coming to your show right now, we had a patient who came in and then his sperm count was so low. But then at the end of the day, you hear him narrating to me like, how does he open up to his family that this is the cause? But then the woman probably would go to different prayer houses now thinking that that's the real problem. Meanwhile, the man who has the lower sperm count is the issue. So most times we normally advise, especially people who are in courtship prior to getting married, that amongst your genotype and other kind of tests you want to do, I think tests that pertain to sexuality should be involved in marital screening. You do not want to trap anybody by saying that, oh, okay, it's for better, for worse, and then at the end of the day, you cannot now perform your duties.
Well, that narrative is changing, because I saw this skit on social media where the woman was asked for better, for worse, for richer, for poorer, and she was like, for richer, for richer. That narrative is changing now, because most people are not looking into that anymore to say, okay, we'll stick together in good times and in bad times. All right, so let's not deviate now. Tell us, how do you contract, or you just said through sex. Yeah. Now, what are the signs and symptoms of chlamydia?
Now, just like every other infection, right? Chlamydia, in extreme cases, you can manifest having rashes, having a burning sensation when you're urinating. Okay,
for the man or for the woman or for both?
Now, for both. Okay. Because for the man, you have rashes around your genitals. Okay. And it might even spread up to your abdomen, your lower abdomen.
Really?
Then for the women, you have painful discharge. Okay. And then you have colorations in your discharge. Okay. these are not the only symptoms, because now chlamydia is a very funny infection. Why? Because most people do not have symptoms. That's what we call like asymptomatic people. They do not manifest symptoms that we see. So that's why most times when you go for IVF screening, you want to get married, you want to conceive, sorry. Chlamydia is a very, very important test to be carried out before they can even start anything. Because why? As little as they think that chlamydia is, that you can actually just buy antibiotics that are not so expensive, it can actually cause the infertility that is the real problem of conceiving. So yeah.
So apart from that, you know other sexually transmitted diseases, when you ask a doctor the signs and symptoms, it will tell you painful discharge or smelly discharge. Or apart from all of that, is there any other thing the woman, because once this happens, like you said, the next thing is running to the nearest chemist to go and get one antibiotics or the other, and maybe that may just relieve the person for a week or so. Before you know what is happening, it's coming down again until that person becomes antibiotic resistant or something like that. Now, what other things should that woman, now let's take it one after the other now, because it happens to man, it happens to woman. So what can that woman really look at in her body? Because most women don't even understand their body. The moment a woman says color discharge, the next thing is, oh, maybe the period is still ongoing, or maybe because as a result of the period. They don't really take proper care. That's most women for you. They don't really take proper care of themselves. They don't understand themselves that much. Everything boils down to, oh, toilet infection. Oh, maybe persistent menstrual cycle or something. So exactly what should that woman look out for, apart from colorful discharge, pain while urinating, or what else?
Well, basically, Ma, I think the truth of the issue is these things that you have actually mentioned are like the real pointers. But for a person who has multiple partners, for example, then I think you should be best friends with like laboratories and your gynecologist, because you would need to actually occasionally go for your normal testing to be sure and certain that you do not come down with these symptoms or you don't come down with these diseases. Because most times, like I did tell you at the beginning of my conversation, majority of the people that we have even seen in our facility, they do not manifest symptoms. We are the ones who even do like sensitization programs to even now elaborate and then tell them that, oh, okay, chlamydia in men leads to infertility, and then in women it can come down with what they call PID, pelvic inflammatory disease. So most times they might just look at it and then just feel like, oh, okay, I'm fine. Now that's why you see a lady that would complain that, oh, during her menstrual flow, she has like very discomforting pain, excruciating pain and all that. I'm not saying that it's excruciating pain during menstruation is as a result of chlamydia, but I'm saying that most times it's already a factor to look out for. That's why most times when you even go to the laboratories, they would want to put you up to even go and do a scan to actually see what's going on in the pelvics. So I think for people who have multiple partners, I would always hammer on this. For people who have multiple partners, even if you do not even have multiple partners, like I did say on radio, we cannot actually tell who is a virgin and who is not a virgin. So you should always get yourself tested. Yes. So I normally recommend to people once every 2 months, casually just walk into a laboratory and then try and get yourself tested to know exactly what's up.
Okay, you just said that chlamydia can cause infertility in male and it can cause infertility in women. And this is one of, when you look at the statistics, you realize that even as you, who is an expert in that field, you realize that we have a high rate of infertility in our society today. Can there be a cure? Is there something these persons can do for themselves? apart from treating themselves from STDs and all of that?
Oh, well, for example, right, if I got your question right, if we're going to treat infertility as a result of chlamydia,
or any other STD?
I'll take it from chlamydia, then I would go to other STDs. If we're going to treat infertility as a result of chlamydia, there is hope.
Okay.
Why? Because I would not come on national TV now and then say the drugs to buy. Why? Because people
No.
would abuse it.
No.
But there is hope, and it's always advisable to speak with your doctor.
Okay, you know I'm asking this question because I know after now, a lot of persons will call in to say, oh, Adesuwa, okay, this, that. A lot of persons have called in to say that, okay, particularly when we treat infertility, that, okay, they have gone to the hospital and doctor says it's infections. You know, when is it, what kind of infection they'll now be moping? They don't know what kind of infection. So when you mentioned chlamydia as one of the reasons why people can be faced with such a problem, that's why I asked that question, so that the person who is watching now will know exactly what to do and where to go to, that chlamydia can actually cause infertility, not just infection. Because I don't know why you go to a hospital and doctor will just say infection without telling you what the infection is all about. And some persons, I don't know if they're afraid to ask questions. You won't ask the doctor what kind of infection is wrong with that person. So a person who has chlamydia has hope.
Yes.
When
yes,
he's treated.
A person who has chlamydia has hope. Now, to the part where you say that when you walk into a hospital, people do not get to be told their medical diagnosis and all that. I think personally it's a way to curb the menace of drug abuse.
Okay.
That's what I think, because most times at the end of the day, when you come to a facility and then they start telling you like, oh, okay, this is what is obtainable and this is what's not obtainable, and then they tell you that, oh, okay, this is the drugs that you were to take at this particular time, you find out that the next time that there's a reoccurrence like that, people just tend to abuse the fact that they have already known the drug they are to take, and which is very wrong. It's actually totally wrong, because the same antibiotics that can actually cure an infection today might not be the same that would cure it tomorrow.
Why? Why so?
Okay, now because they have what we call the antibiotics resistance factor.
Okay.
Right? Now, for example, you have been taking a certain drug for a very long time. Your body tends to develop a resistance to that drug. So when Mr. A takes, for example, flagyl, and it works for him, and then me, I have abused flagyl because I heard that flagyl is used to cure stomach upset. And then we are having the same symptoms, and then we're manifesting the same symptoms, and then you're taking flagyl and you're better, and then I'm taking flagyl, and then everybody's looking at me like, what's wrong? And then the next thing, you're now seeing that when I now walk into a facility and then they now do a test, flagyl will be resistant for me. Okay. And then it will be a much higher antibiotics that work for me at that point in time. But then people do not tend to understand this. They just feel like, oh, okay, Mr. A used this thing, so it's supposed to work for me. And it's wrong. It's wrong. That's why I think most times they try to curb the way we divulge informations to patients, because patients would actually think that they are now mini doctors or medical practitioners by just knowing very few things. And then similarly too, there's another thing that we call cyberchondria. That's trying to browse your own diagnosis.
I was going to go to that. So, these days, people don't even need doctors. Right. Just go on your Google.
Right.
And you're there.
You think Google is your friend, but then Google will give you hypertension faster than even the cases in Nigeria would. So, you know, funny how once you start browsing your symptoms, for example, you have a headache now, maybe associated with fatigue, and then you start asking Google, what if I have a headache and then my leg is twitching, and then Google is telling you that is a sign of, let's say, maybe Google comes and then tells you that's a sign of early form of psychotic madness or something, and then you're like, oh my God, I'm going mad.
So we should not trust Google.
So at the end of the day, you see that.
Because I Google it.
No, I'm sure you must have come across what I'm trying to say. And then you browse your symptoms, yes, and then Next thing, you are so scared, and then you cannot even talk to anybody anymore. You are like, oh, I'm going to die in a matter of days. And meanwhile, maybe you just have headache from fatigue, and then you are just there, just assuming. That's why we do not allow, we do not advise people to browse your symptoms. Rather, talk to a trained practitioner.
But I remember once upon a time I was discussing with a doctor, and the next thing she brought out her phone and started Googling the condition I was describing to her, and I was like, is that what you're going to use to attend to me or what? He said, no, I just want to check. So doctors, they do Google too. No,
it's different. Why is it different? Because when you explain your symptoms to a medical practitioner, right, they narrow it down to certain things. Okay. But you in psychology, you are a blind mouse. You have no idea about what you are checking out for. Okay. But then for the person that you're talking to, he already has an idea that, oh, okay, we're looking in this light. Okay. So him browsing and then you browsing, you are browsing from two different points of view. So you cannot now say that, okay, because he decided, it's more like saying now, I want to administer a drug to you, and then I'm not looking at the side effects, and then you think that I'm browsing to know your symptoms, which is actually very wrong, because I'm actually trying to cross-check to know whether I'm going to actually do a good job or not. Okay. So chlamydia, back to chlamydia now. How long does it take to cure chlamydia if it's curable? How is the curation process like? It varies. It depends on the people you meet, right? But standard process should be between 7 to 14 days. 7 to 14 days? Yes.
Can it reoccur?
Oh, yes. Yes. It will reoccur if you have a very crazy lifestyle. So it's not a matter of you saying that this is what is obtainable. Okay.
Crazy lifestyle, as in if the person is promiscuous.
That's right.
But some persons can be promiscuous while their partners are not. So it still boils down to the same thing.
That's what we're saying. That's what we're saying. So that's why, it's advisable, if you must be promiscuous, always protect yourself. And then for other sexually transmitted diseases, right, I always advise that because of the sensitivity of a woman's body, right, most times it's very easy for different things to cause an imbalance and then bring about maybe an infection. So it's advisable to, for example, when they want to use public facilities, they should always try and disinfect. Okay. Yeah.
But doctors will also tell you that using disinfectant is a problem for the woman.
Oh, no, I am not saying you should disinfect yourself.
Okay, the facility, the toilet you're going to use.
The area you're going to use, yes. That, at least that helps curb these microorganisms to a large extent. Okay. Yes.
All right, Charles, thank you for finding time to be with us on this program. And if you want to continue with this conversation, please give us a call on 081-3802-8250. Call us on 081-3802-8250, and we will continue with all of this that has to do with sexually transmitted diseases. It is one area of life or one area of medicine that people don't want to talk about because of stigmatization and, of course, the shame factor, so that people will not laugh at them, and because some persons don't really know how to present. So we have talked with Dr. Charles Onwachukwu today. He's a medical lab scientist and the CMD of Chonak Diagnostic Center. We'll do this again very soon. Thank you for finding time to be with us yet again. All right, guys, so see you again next week. Bye-bye.